Good day to the viewers. Today we are going to discuss about gout. Now let's get into the slides. Gout is a disorder of urine metabolism. It is the condition which occurs due to the increased level of uric acid in the blood. It is due to the accumulation of urate crystals in the synovial fluid resulting in inflammation leading to acute arthritis. Gout is characterized by severe attacks of pain, swelling, redness and tenderness in the joints, specifically at the base of big toe. At 30 degrees Celsius, the solubility of uric acid is decreased. Therefore, tophi occur when uric acid is deposited in cooler areas of the body. Deposits of aggregated crystals known as tophi. Thus, tophi are seen in distal joints of food. Gout is always consistently preceded by hyperuricemia. Hyperuricemia is due to excessive amount of uric acid production or decreased excretion. The normal level of uric acid in female is about 2 to 5 mg per deciliter. In male, it is about 3 to 7 mg per deciliter. Coming to the classification, gout is classified into primary gout and secondary gout. Primary gout is a disorder of urine metabolism. It may be due to overproduction or under-excretion of uric acid. Primary gout is predominantly seen in men. It involves genetic and non-genetic factors. The occurrence of gout in women is uncommon, but it is usually found in postmenopausal women. Secondary gout develops as a combination of hyperuricemia caused by another disorders such as leukemia, chronic nephritis, polycythemia. This type of hyperuricemia usually associated with abnormally rapid turnover of nucleic acids. This specific type of gout can be observed in both adolescents and children. Now we'll see about the causes of gout. Primary gout is caused due to the following reasons. First, 5,5-phosphoribosyl amidinotransferase is an abnormal enzyme which is active but not sensitive to feedback regulation by the inhibitory nucleotides. This would lead to overproduction of purine nucleotides. The second one is abnormal phosphoribosyl pyrophosphate synthetase. It is an enzyme that is not subject to normal allosteric control mechanisms, and this could lead to an increased production of phosphoribosyl pyrophosphate. This condition is X-linked and recessive. The third one is deficiency of enzyme of salvage pathway. This would result in increased availability of phosphoribosyl pyrophosphate and decreased purines. So feedback inhibition is lost. The fourth one is glucose 6-phosphatase deficiency. This condition is known as von Wrege's disease. When this enzyme is deficient, glucose 6-phosphate cannot be converted to glucose. So more number of glucose is channeled into the pentose phosphate shunt pathway, resulting in increased availability of ribose 5-phosphate. This would lead to increased formation of phosphoribosyl pyrophosphate. And the last one is glutathione reductase variant. This enzyme depends on NADPH generated by pentose phosphate pathway. The abnormality in enzyme leads to increased production of ribose 5-phosphate and thereby increased level of phosphoribosyl pyrophosphate. Dysregulation of the rate limiting step of purine nucleotide synthesis leads to increased synthesis and degradation of uric acid. Then causes of secondary gout, which includes both increased production of uric acid and reduced excretion rate. Increased production of uric acid may be due to enhanced turnover rate of nucleic acids as seen in the following causes. Rapidly growing malignant tissues, example leukemia, lymphomas, polycythemia. Increased tissue breakdown after treatment of large malignant tumors. Increased tissue damage due to trauma and raised rate of catabolism as in starvation. And the second one is reduced excretion rate is caused due to renal failure, treatment with thiazide diuretics which inhibit tubular secretion of uric acid. Lactic acidosis and ketoacidosis is due to interference with tubular secretion. Now move on to the diagnosis. Diagnosis can be made by examining medical history, medication history, family history. Lab tests include measure uric acid and ESR levels in blood, synovial fluid analysis, X-ray of the joint. Next, coming to the treatment. Treatment of gouty attack is typically focused on decreasing the pain and swelling, most often with non-steroid anti-inflammatory medications like brufen or naproxen sodium, but occasionally with corticosteroids. Colicizin, which has anti-inflammatory effects by inhibiting white blood cell migration, and also been used for a long time to treat gouty attacks. To treat the underlying cause of increased uric acid, though it is important to modify the diet, doing things like staying well hydrated, reducing alcohol, and avoiding purine-rich foods such as shellfish, red meat, organ meat, etc. There are also medications that help to decrease uric acid levels, which include xanthine oxidase inhibition like allopurinol. Allopurinol is a competitive inhibitor of xanthine oxidase, thereby decreasing the formation of uric acid. Xanthine and hypoxanthine are more soluble, so both are excreted more easily. And the final one is uricosuric medications like probenecid, increased excretion of uric acid by the kidneys. Thank you for listening.